Breaking news. A new Smombie 22 virus is spreading around the world. How do you know whether you are infected? The known symptoms of the Smombie 22 virus are the following: a constant neck tension, headache, migraine and eye pain. The virus spreads mainly if you use your smartphone or other gadgets more than 1 hour per day. The virus spreads more easily if you are isolated from other people. Luckily, a couple of brave scientists from the University of Koblenz have developed a method that analyzes your personal neck posture and give you immediate feedback on this. Using their research, the incidence number of the Smombie 22 virus can be reduced. Due to the rise of the popularity of smartphones, for most people they have become a part of daily life. As useful as those phones may be, they result in a bad posture for most people, namely bending over. In the project Smombie, the new effective approach has been proposed that measures a craniovertebral angle of the patient from a single RGB image. Using the craniovertebral angle, CVA, valid statements can be made about postural weaknesses. Usually, such measurements are collected via markers attached to the subject's body. This study presents a novel method to automate the detection of the landmarks that are required to determine the CVA in RGB images. The CVA is determined using lateral view images of the head-neck postures as the angle formed between the horizontal and a line drawn from the midpoint of the ear-tragus to the point on the skin overlying the tip of the spinous process of the seventh cervical vertebra, C7. In order to automatically calculate the CVA, two anatomical landmarks, the ear-tragus and the spinous process of C7, must be detected first. For the detection of the required landmarks, a neural network called MediaPipe pose, that estimates a human pose from a 2D image, is applied in the first step. Using the calculated 2D key points, the region of interest is extracted in the image, where only the neck is visible. This region is marked red in the figure. Next, the Harris corner detector is applied to the extracted region. The algorithm then searches for the line containing the most corner points. When this line is found, the points are determined that intersect the neck contour and the approximation line. Now, you can see the intersection points that are marked red. The 2D position of the C7 spinous process is located in the middle of the intersection points with the maximum distance from each other. For the detection of the ear-tragus position, the same neural network is used in order to find the required region of interest. Once the region of interest is found, the ear contour needs to be first detected by approximating an ellipse model on the outer shape of the ear. In the final step, the ear-tragus can be estimated by analyzing the pixel intensities inside of the ellipse. In order to assess the proposed methods, a custom dataset was generated with a total of 79 subjects, of whom 45 were male and 34 were female. For each test participant, the following additional data, required for the CVA analysis, were collected: demographic data such as age and gender, spinal disorders, and average daily duration of smartphone usage. The estimated daily duration of smartphones usage among the test subjects was 3.16 hours on average, in a range from 0.3 hours to 7 hours. The images in the dataset showed each subject performing 4 head-neck postures: straight neck, maximal head flexion, forward head posture, and head-down position. The labeling of the captured photographs was performed by 3 experts on the 2D data. The results of this study are published in MDPI Biomed Informatics Journal and are available worldwide under an open access license. In this study, a simple, non-invasive and low-cost method was developed that allows the analysis of the head-neck posture applying only a RGB camera. This approach can be used by professionals who perform postural assessment, both for investigation as to aid in the clinical diagnosis and in the therapeutic approach.